Yeah, sorry about that. Can you see me now? Can you move this one here? Oh, can you see me now? Yes, screen sharing and then do open. Just I want to. Oh, yeah, I mean, saya pikir ini enggak. Oke. Huh? Can you bring me here? Jadi. Bisa. Okay. The rest, yeah. Okay. The rest itu banget. Okay. So is it okay? Can you see me? Can you delete it? Is it okay? Can I continue?
Yes, Dr. Azaman. Yes, we can.
Okay.
Yeah, we have to. You might want to backtrack a few slides, yeah, because
gangrene is a slide now.
A few more slides, I think. Yeah.
A few more. Backtrack.
Yeah. Okay. Yeah. Okay. All right. Okay. Thank you.
The study I mentioned, so-called high desert heart institute study, and this is the next one about gangrene. Did you get to hear what I said about gangrene just now? No, didn't. Okay. I go back to this is Dr. Siva Salam and Joseph Prendergast and the High Desert Heart Institute study. Did you get this one? I mentioned about the study. No.
Or why don't you start? Why don't you start from there? Yeah, that'll be fine.
This one, the study.
No. Just yes. Yeah, this one, yes.
Yeah, this one. Okay. So this study actually was very interesting because it shows that nitric oxide supplement does have a role in patients who are already being treated and still are not well. Because it's very common. We give a lot of medicine for patients, but they still do not improve. So you can add on nitric oxide and it does have an effect. And this was eventually, this is the Dr. Siva Abdul Salam's words himself, that he himself was very surprised, very amazed by what happened to the participants. They improved so much their life, and also where the parameters of improvement were seen. It was very remarkable, and I was convinced by that. And in my practice, this was one of the earliest condition that I used nitric oxide supplement. It was gangrene. Usually diabetics have got this, and this is the so-called peripheral blood vessel disease. The blood vessels basically are not functioning normally. So you have this is not because of germs, but because the blood is not flowing normally. The blood vessels are diseased. So I found that when I give nitric oxide supplement that I was using then, the improvement was very remarkable. But because the time is quite short, I go straight. First, the other thing, Mr. Nicholas, can you just tell me whether it is possible to add a few minutes the injury time? Because we have missed.
Boleh. Don't worry. Take your time. Take as much time as you need. Yeah? No worries.
People are not fasting me, but I am fasting. I'll much later. So okay. So this is one of the conditions which I found very remarkable. When I started my practice in Penang in orthopedic in 1987, a lot of this ended up with amputation. And I found that with nitric oxide supplement, I managed to achieve something which I never thought possible. And as a result of that, a lot of patients were very thankful. And there's a doctor here whom I taught how to use nitric oxide supplement just for this condition. And she became very famous. People from as far as Perak and 200-300 miles, 200-300 kilometers away came for this treatment when they have got gangrene. And this was achieved by using nitric oxide supplement only. And I have treated patients just using nitric oxide supplement, no other medication. and they continue on the medication, and they're still walking around now, very happy. One lady whom I treated, and she absconded from hospital, was due for amputation. I used nitric oxide supplement and coconut oil, but it was nitric oxide supplement that helped her. She just passed away because of other illness recently, and I treated her in 2013. So it was born at 7 years. So it's very, very remarkable. The other one is a patient with renal failure, kidney failure on hemodialysis, or about to go for hemodialysis. And when I gave nitric oxide supplement, and they started improving. And those in hemodialysis who have not passed urine for 2-3 years started passing urine, and they're very happy. We pass urine all the time and every day, and we are not so thankful. But these people have not passed urine, and sometimes they dream of passing urine. But when they took this nitric oxide supplement, it helped them very much. But there was a great difficulty because many of them are on fluid restriction, and the particular supplement that I use, you need a lot of water. You need to reconstitute 200, 250 ml. So it's very difficult. You have to start little over there. I'm coming back to that. This one improved, and this is my experience in Kuala Kedah, where I ran the clinic, ischemic heart disease. There was in fact, there was one patient which I put in YouTube. Very hard to find because so many videos now. He was due for stenting. He took the supplement, and when he went to check back, he felt so good. He went and checked, and it was normal. It was normal, and the cardiologist told him no need for a stent. He was very happy. And hypertension, of course, hypertension is high blood pressure anyway, chronic high blood pressure, so bring down chronic ulcers, diabetic gangrene, bronchial asthma, because nitric oxide is also used by the lungs for lung function. Erectile dysfunction, yes. Sometimes even they take Viagra, it's not working very well for some reason. So you add on, they are patient. And the other thing is sometimes they need one tablet of the Viagra with nitric oxide supplement. They can take only half. Memory loss, yes. Irritable bowel syndrome and post-stroke. It helps very much after stroke for patient to recover, and sportsmen. These are my experience last time. There are other indications after that, and now of course we know it is also very good antiviral, antibacterial, antifungal, antiparasite, but I haven't used that. And this is very briefly the pathway that when we use that particular, most of the supplements in the market, when we use it goes through this pathway. You give L-arginine, it goes into this cycle, urea cycle. You couple with L-citrulline if you want to perpetuate the cycle, and from there you produce nitric oxide in the cell, from the cell. So this is one way. But later, not too long after I used this, I discovered something else. This is Tengku Razali Hamzah from the Parliament. Yang Berhormat Mulia Tengku Razali Hamzah. I think politician like me will know him. Younger politician may not know, like our Buang, Syed Sadiq, 37-year-old. Don't know him as a person in long time ago in the 70s and all that. He was claiming then about the time that he is healthy and he's still able to perform. And of course, recently he offered himself to become Prime Minister, and he gave that credit to taking noni or mengkudu. This is something interesting, mengkudu. And what happened in mengkudu? Mengkudu or noni, much later, I discovered the mechanism, the pathway. Mengkudu has got a lot of nitrates. Mengkudu is one of the nitrates-rich plant. Every part of mengkudu, from the fruit, from the leaf, from the bark, from the shoot, everything has got nitrates. And the Malays have been using this as supplement and medication for a very long time. And Tengku Razali Hamzah attributed his help and his ability to be re-elected again as a member of parliament, perform as a member of parliament because of mengkudu. That is very interesting to me, and that to me is not just interesting, it is also fulfilling something else in my family. I'll come back later. This is noni. For those who do not know, in Kuala Kedah we have got a lot of this by the seaside. and then people, you just pluck this one to throw at goats coming to their compound. You've got a lot, but this is a wonderful fruit, and this is a mengkudu. Apart from producing nitric oxide, it has got a lot of other things, antioxidant and whatnot. But most of these attributes, most of these benefits of mengkudu actually come from the fact that it's used by the body to produce nitric oxide. And interestingly, this is the second pathway, which is becoming more important as we grow older. Because the first pathway of L-arginine coming into the we take anti-arginine coming to our body, it goes into the bloodstream, it goes into the blood vessel, goes to the endothelial cells. Endothelial cell will produce nitric oxide. But as we grow older, this particular pathway becomes less and less efficient. Many reasons. So if you are 40-year-old and above, that pathway is only 40% effective compared to when you were in your 20s or 30s. It's becoming less and less effective for many reasons, and one of the reasons is because as the blood vessels grow older, the endothelial cells also are functioning less efficiently. But mengkudu is different because mengkudu and the nitrates-rich plants, mengkudu, beetroot, and many other things, nitrate-rich bayam as well. When we consume that, the nitrates is converted to nitrite by the good bacteria in the oral cavity, especially around the tongue, in the fissures of the tongue and all that. That converts to nitrates to nitrite, and that nitrite is converted to nitric oxide, and that through the action of the gut as well. And that is more important. And that is what I have to say. I'm not here trying to endear myself to Mr. Nicholas Tan by saying this, but I was very surprised that when I was introduced to Nitro FX, it worked so well in me. How do I know it works so well? Because it positively affects my sleep. I had a very good sleep, deep sleep, and I know because I managed to complete all the sleep cycle, the non-REM deep sleep and the REM, rapid eye movement phase of deep sleep, and I knew this was something as remarkable as my first experience when I was much younger, 10 years younger, with the L-arginine. It was very good. And the other thing is, how do I know that a supplement of nitric oxide works? Just briefly, Mr. Nicholas Tan, can we continue? Fine with me? Okay. How do I know? And I tested with Nitro FX, and I was surprised. Number one, my blood pressure. I am one of those people, actually many people are like me. When we wake up from sleep in the early hours, if we take blood pressure will be high. And that is called the express stream by some people. And that's the reason why the surge of blood pressure before we wake up can go very high. And in some people that leads to stroke and heart attack and all that. Stroke and other problems and the bleeding for people who are high risk. I am like that. I can have a restless night in the parliament, and then my blood pressure will be 140/90 immediately upon waking up. Whereas my normal blood pressure is around 120, 120/70, 120/80. And later, much later, because of a few things, my blood pressure came down to 110/70, which I love it. But still, before taking Nitro FX, when I wake up immediately like that, it can go. If it's a restless night, I did not get much sleep, much rest, it will be 130, 120, 135, 140, and later it will come down. After I perform my prayer, it will come down to normal. But with this Nitro FX, even though I don't sleep well, blood pressure maintained. So that is for me one indication. The other one that I know, and the other one is I get restful sleep. And if I dream also, it's not nightmare, it's restful. It's relaxing, come back, and I feel fresh, very fresh. So that means the concentration is high enough to affect the brain. The concentration can be high enough for erection, but not the brain. The brain requires much more concentrated, much higher level of nitric oxide. Number three, of course, this is being frank. I monitor with early morning erection. And early morning erection is very important because studies have shown if you have weak early morning erection, that is associated with higher risk of having stroke and heart attack. Stroke, especially stroke. Many papers show that because it shows poor circulation, and this one gives very strong early morning reactions. So I know this is particular and remarkable. And I am now, because of that, I am not to say persuading, but I would recommend someone who's like me, entering 6th decade anytime, or at the end, or after 40, should be utilizing this pathway. And NitroFX has done very well. I'm saying this sincerely from my heart, and I have tested around 10 nitric oxide supplements, available in Asia and not available, to the point that my 10 or my 12 bottle was blocked by the customs because there was no permit. There was a citrulline and all that, but claimed to be very good. But I know that this particular one is very interesting. And the other thing that this one works, the other thing about NitroFX, I would say here, just for information, if you have someone who is going to have renal failure, and that someone will benefit from nitric oxide. My other supplements have problem because you have to reconstitute that with a lot of fluids, and they are on fluid restriction. But this one, very little fluid. For that, I would like to congratulate everyone at Kiani, because you managed to get the nitrates concentrated just 1 ml, and you can have the effect. And even people with gangrene also, when they are on fluid restriction, they cannot take much fluid, they can take only 500 ml per day, we have problem. But with this one, it's very remarkable. And almost magical, may I add. And the other thing is, this is my grandmother. She passed away in 1961, a long time ago. And for me, the personal fulfillment of her wishes, she wrote a lot of messages and notes and letters, and until now we can discover she was a copious, prolific writer to the children. And one of the things that she kept on stressing was for us, her descendants, to consume noni, mengkudu, for good health. And it was reported that she was in good health. This was one of her last photos, and she was then nearly 80. But she was in good health, and she attributed that to mengkudu. But of course, we didn't know nitric oxide or whatever. But she